Good Sam was a teaching hospital, so we always had interns and residents and staff around. I mean, Reid had no doctors at night. They would call them in if it was necessary. They didn't even have them in the emergency department. I stayed at Reid for 11 years, 4 years full-time, and the rest part-time, because in nursing you can do that fairly easily. So when I started having children, I worked 3 days a week. I went to public health nursing for a year and a half, and then I came back to Reid in '78 and worked there until 11 years ago. When I first went to Reid in '65, it was $2 an hour for a registered nurse. And they gave you, I can't remember if it was 10 cents or 30 cents for working nights. Nursing assistants made 50 cents. I know there were at least, when I started in '65, there were at least 2 black LPNs that worked, but I don't remember any other registered nurses, and it could be that I'm just not thinking, because sometimes people came and went, and at times I was the only black nurse in Reid Hospital, that when government agencies came to inspect us and stuff, I was always pulled out as, and this is our black nurse, Mrs. Bennett. The Human Resources Director had talked to me several times about why they couldn't interest other blacks in going into nursing. I said, because they've done domestic work, and that's basically what nursing is. It is domestic. I mean, you know, it requires an education, but you're cleaning people, you're cleaning areas, you're, you know, doing those things that may not be attractive to someone as times changed. It's being able to help people. I see people even now, and I've been retired 11 years, who know that I took care of them, you know, and some of them I took care of 3 generations of the family, you know. The ones that have anything bad to say don't really approach me, but other ones, it's just totally amazing. And I tried, when I was still in school, to act like I knew who someone was, because she came up to me just, you know, so glad to see me and everything. And it turned out I had taken care of her child in pediatrics, and he died from a kidney cancer. But I hadn't the faintest idea who she was. And, you know, as I said, I tried to do that pleasant thing. And she says, "You don't know who I am, do you?" And I said, "No, not really." And now I don't even fake it. I said, "Tell me who you are." I liked probably most when I worked the post-anesthetic recovery. You got them when they were totally sedated, and sometimes you had to control the breathing, you had to watch their monitors, you had to correct things and stuff. I cannot remember anyone that left my care that wasn't better than when they came in, because they were breathing on their own, their heart was stable, you know, they were hydrated, all the things you had to watch. So that was, and it was a short time, like the most time that you spent with someone was 3 hours, which doesn't sound good for me personally to say this, but I have a short attention span. Yeah, I'm into acute nursing rather than chronic nursing. Because I had a long career, I was a registered nurse from 1965 until 2021. One time the president asked me how many jobs I'd had at Reid, and altogether I worked 43 years at Reid, part-time and full-time. And during that time I had 13 jobs. For never having wanted to be a nurse, it was rewarding that you got your reward from patients and families mostly.